Hi, I'm Nate Sand, nurse practitioner with Allegheny Surgical.
And I'm Rachel Blinn, nurse practitioner with Royal Oak Surgical Associates. We oversee the lap band aftercare programs in our practices.
A follow-up program for patients who underwent the lap band surgery. Today we'd like to share with you what makes this program work and how critical your role is to the success of your patient's long-term weight loss,
health improvements, quality of life, and life expectancy. As you know, multiple factors contribute to the development of obesity: genetics, hormonal imbalances, cultural and environmental issues, psychosocial issues, poor eating habits, lack of exercise, to name only a few. So it is no surprise that a multidisciplinary team of healthcare professionals is required to support lap band patients throughout their weight loss journey and to help them achieve and maintain long-term weight loss. Start by explaining to your patients how important it is for them to take advantage of the team of experts you have assembled to help them through every aspect of their journey. It is their weight loss team. Your patients most likely have tried diet, exercise, and behavior modification therapies, but when the programs ended, they regained all the weight they had lost and sometimes even surpassed it. Tell them that their weight loss team will always be available for them. Like a coach, their team is there to see them through difficult times and successes. The team is also there to help them realize how to implement and maintain a healthy balance while guiding them through life events in order to reach and, more importantly, maintain successful results. Just like their team, patients have to be committed to success. They have made the first step forward by getting a lap band system. Now they have to change their lifestyle. Change is hard for anyone, no matter what the change. Encourage them to involve their family, friends, and support system. Talk to them about including their close ones in their new plans. And don't forget to let them know about various patient support groups in their area and online. Consider providing a support group directed by your practice. Let's review the ABCs of success, or rather, the ABCDEs. The ABCs of success. A, adjustment of the lap band. B, behavior modifications. C, commitment to success. D, dietary plan. E, exercise routines. Although we'll review the ABCs in detail later in our presentation, here is a brief overview. Adjustment of the lap band system. The lap band system is designed to be adjusted as needed to customize patients' sense of satiety so they feel satisfied with less food, less often. This will allow them to feel fuller faster and longer when they eat. This is one of the key benefits of the system. This feature will allow you to determine the fill volume of the band that is right for each patient. Initially, the band is typically empty. This allows for any edema to resolve while allowing the patient to adapt to the band during the first few weeks after surgery. Usually, the first opportunity for an adjustment takes place 4 to 6 weeks after surgery, but the timing and the amount of adjustment may be different for each person. The first adjustment typically makes the band a little tighter to help patients feel more satisfied and learn portion control in order to start losing weight. To determine if your patients are ready for an adjustment, consider the following factors. Adjust the band based on level of hunger, true hunger versus mind hunger and cravings, amount and type of food that can be eaten comfortably and how long it takes to eat them, activity level, how much fluid is already in the band, speed and amount of weight loss. 1 to 2 pounds a week is ideal. The band should not be so tight that the symptoms of obstruction dominate. The band is there to control hunger with smaller portion sizes of quality of food and not intended to obstruct them or punish them from eating. Tell patients to immediately contact you so their band can be loosened or even removed if they experience the following symptoms. Loosen the band if patients experience the following: nausea or vomiting after eating, night cough or night reflux, recurrent respiratory issues, pain with eating following oral intake, difficulty swallowing, inability to swallow or inability to eat solid foods, inability to eat more than 1 to 2 bites of food at one time. When asking patients about food tolerances, you may find patterns of maladaptive eating if the band is overadjusted. These are called slider foods. It is important to be specific in dietary review in order to identify maladaptive eating patterns.
Behavior modifications. A number of psychological factors may have contributed to your patient's obesity and may represent a risk for adherence to the weight management program that you have outlined. These factors provide clues that the healthcare team can use to identify at-risk patients and provide early intervention and behavior modification tips. So it is important to assess what they are as early as possible. A well-adjusted lap band controls a patient's hunger, and patients have an opportunity to succeed, even if in the past they have failed repeatedly because hunger and old habits were overwhelming. Sometimes patients need a band adjustment, sometimes they need a behavior adjustment, and sometimes they need both in order to achieve and maintain successful weight loss. Ensure patient psychosocial support. Evaluate patients' psychological status on an ongoing basis. Utilize standard evaluation tools and chart results. Refer patients for psychological counseling or behavior modification therapy before risk factors become obstacles. Overall, the more support patients receive while trying to lose weight, by whatever means, the more likely they are to succeed in achieving and maintaining weight loss. According to the National Institute of Health statement, patients should be encouraged to consider joining a support group. Many studies have demonstrated the value of support groups as part of the bariatric surgery treatment plan. In a study of the role that support groups played in weight loss surgery after lap band system surgery, patients who regularly attended support group meetings tended to lose more weight, and increased frequency of attendance was associated with greater weight loss. Support groups provide the healthcare team with an opportunity to implement interventions specific to the needs of the patient in the group. Patients can see that they are not alone. They may gain insights from others' experiences and also help each other through empathy and understanding. They also will allow you to provide information to more patients in an efficient manner.
Commitment to success.
We talked about the importance of patient commitment to success and therefore to lifestyle changes. The following techniques are recommended to solidify your patient's commitment. Solidifying patient's commitment: contract, compliance questionnaires, support groups within practice, capabilities of a wide variety of office staff members, vigilance. Have patients sign a contract that outlines specific goals, benchmarks, and strategies you have established together and they agree to follow. Just like any journey, they need a roadmap to successfully navigate their way. Expectation management is a vital part to weight loss journey. Let them know that it takes a few adjustments to get there. With their first adjustment, we find their neighborhood. With the second, we find their street. Perhaps by the third, we find their house. It is important to give the patient realistic expectations in order to help them along their journey. Develop and administer compliance questionnaires that incorporate subjective and objective measures of compliance. Identify risk factors that contribute to non-compliance in diet and activity programs. Educate patients on risk factors that might undermine their success and document this in the patient's chart. Establish support groups within your practice that meet specific patient needs. Correlate frequency of support group meetings with benchmarks of success among your patients. Make support group requirement decisions on a patient-by-patient basis. Draw on the capabilities of a wide variety of office staff members or external professionals to facilitate support group meetings. Consider including the surgeon in support groups at regular intervals to discuss specific management issues. Continued vigilance will ensure that your patients receive the support they need. Each practice should select educational methods and monitoring tools based on their patient's needs and the counselor's style and experience. For instance, some patients may prefer group counseling, where the group can provide mutual support and patients can discuss their own successes and failures in a safe environment. Other patients may fare better in one-on-one counseling sessions. Be prepared to tailor the approach based on the patient's current needs. For instance, by offering one-on-one sessions to patients who are reluctant to discuss specific issues in a group setting. Self-monitoring is a key tool with documented value in promoting weight loss and maintenance. Individuals who self-monitor as part of a behavior modification program for weight loss are more likely to adhere to weight loss treatment program and experience greater weight loss than those who don't. Reminder calls are useful to re-engage patients who have not visited or contacted the practice after a certain number of months. Patients typically stop following up not because they're doing well and don't need our help, but rather when they are getting off track. Usually there are life events that happen that cause them to lose focus of the routine and end up reverting back to old habits. This is when they need our help the most. Reach out to them in a non-threatening way to check on how they were doing and provide them the opportunity to come back. Be non-judgmental and supportive in order to help them re-engage with the multidisciplinary team and assess the support they need to get back on track. The tone and language used with patients are very important in this case.
Dietary plan. Improving eating behavior begins with education about proper nutrition. However, building better dietary habits is a lifestyle change, not just a matter of education. Patients may have a solid understanding of what they should and shouldn't be eating, but where they struggle is how to implement and maintain these choices within the context of their daily lives. This is where you really need to help them. It requires effort, time, and commitment from the patient, along with support from the practice. As you may have seen in your own practices, and studies have demonstrated, patients are unreliable when it comes to self-reporting unless they keep a detailed journal. A lot of patients have misperceptions regarding certain foods. They may feel they are making healthier choices and improvements from their previous eating habits. However, these choices may not be the best for weight loss. For instance, they may not account for liquids when assessing their food intake. Fruit juices are often perceived as healthy, despite their high sugar and calorie content. Other examples of perceived healthy foods include muffins, cereals, and salads, even when low-fat dressings are used. Patients may be continuously educated and monitored to ensure they are implementing the necessary dietary lifestyle changes. Dietitians play a pivotal role in setting realistic expectations and assuring that patients' diets meet the requirements of the lap-band system. The new diet must include all needed nutrients like protein, carbohydrates, and vitamins. Avoiding liquids containing calories is very important. Patients should focus on a meal plan that is based on the 2 P's, protein and produce. Tell your patients to make sure the small amount of food they do eat is good, nutritious, high-quality food, such as high lean protein foods, fish, meats, eggs, dairy, lentils, soy, tofu, beans, etc. About half the meal should be protein-rich. The other half should be high in complex carbohydrates, like produce. Non-starchy, low glycemic index vegetables and fruit should be used in moderation. Encourage adequate water intake as part of the overall healthy eating pattern. Stress the importance of 0 or very low calorie liquids. Once a dietitian has tailored a plan for your patients, it is critical to designate someone in your practice to take the responsibility of helping your patients maintain healthy eating habits. With every office visit, patient adherence to your guidelines and recommendations should be monitored, and your patients should continue to be educated on changing their eating behaviors accordingly.
Exercise routines. Exercise is an important component of any weight management plan. However, be clear with your patients that significant weight loss is rarely achieved with exercise alone. Increasing simple daily activities should be the starting point for most lap-band patients. Start by focusing on increasing non-exercise activity thermogenesis, otherwise known as NEAT. Examples of increasing NEAT would be walking to the corner store rather than driving, taking the stairs rather than the elevator, parking farther from the door when shopping, walking up 2 flights of stairs rather than 1, walking a little further and longer every day. These types of normal daily activities allow for success and easy tracking of gradual improvement. As patients begin to experience weight loss and a reduction in obstacles to physical activity, they can expand into formal exercise programs. For large, super obese individuals, it is a good idea to prescribe movements and exercise through physical therapists or exercise physiologists so they can design progressive programs that account for patients' mobility issues. Some patients consider exercising a burden and may initially think of it as impossible or even punishment. Initially, the patient's size may make it hard to begin an exercise program. In cases like this, it is wise to begin with routines that include simple movements. It is important to always consider the psychological stress associated with exercise for some patients. The idea of going out for a walk or wearing a bathing suit at a public pool can be extremely intimidating. When recommending specific types of exercise, be sure to assess their current perspective on exercise as well as any physical or perceived barriers. When developing recommendations, guide patients to allow them to identify an activity plan that they feel that they can implement and maintain. Stress the concept of increasing daily activity rather than exercise. Once the patient has initiated an exercise program, gradually expand the program to include more vigorous forms of exercise, such as cycling, jogging, and aerobics. Patients must understand that physical activity helps in the treatment of obesity in many ways, so share this information with them. Benefits of physical activity: burns calories, builds and maintains muscle mass and tone, increases metabolic rate, improves circulation, improves heart and lung function, increases a sense of self-control and builds self-esteem, reduces stress levels, increases endorphins and energy levels, increases the ability to concentrate, improves appearance, reduces depression, suppresses appetite, provides better sleep quality.